So up next, we have the first panel discussion, which is digital health ecosystem, interoperability, integration, and seamless patient experience. In this particular panel discussion, we're going to explore the challenges and opportunities in creating the interconnected digital health ecosystem that promotes data sharing, interoperability among various health technologies, and ensures seamless experience for patients across different platforms. In this session, we have Mr. Nitin Gupta, Managing Director, India and South Asia, Fuji Films Sonside India Private Limited. He is the moderator for the session, so welcome. We have Dr. Arjun Dang, CEO, Dr. Dang Labs. Welcome, sir. We have Dr. Ashish Chaudhary, Managing Director, Akash Healthcare. Dr. Harsha Guduru, Founder, Restori Healthy Tech Private Limited. We have Ms. Deepika Thakur Gandhi, India Business Development Head, Cleveland Clinic. Mr. Anurag Saxena, Chief Business Officer, Reverie Language Technologies. Welcome all of you, sir. And I would hand it over to Mr. Nitin Gupta to take the discussion forward. Thank you so much, sir.
Now, is it okay, Mayank?
Yes, perfect, sir.
Yeah, thanks. So, Mayank, I was hearing to the past session, and I think we all as an ecosystem is moving towards digital India. And so once again, good morning and thanks for joining in. So like this digital health initiative, digital health ecosystem, which we are talking about, I think is the need of the hour. And like, as a country, we aspire to become developed country by 2047. And we all know, developed country depends a lot on the citizen, how citizen health is there, and health is something which is the top priority of any economy, and GDP is directly related to health of the citizen. So I think this is very interesting subject, and particularly I am very digital savvy, and the fintech has changed the landscape of finance industry, the way this technology, the app culture, and the faster mobilization is there. I think same is required in health. We have made a good progress, but yes, I think a lot to do, and good to see different stakeholder. And in this panel, I think very diverse panel, where I think we have from hospital side also, healthcare provider side also, and back from a trade side, those who develop equipment, software, solution side of healthcare also. I think very diverse panel, and I think we would like to discuss around interconnected healthcare ecosystem in depth. And I think why the first question arises, why probably health, digital health and data is so important, because as a patient, we visit hospitals, and then we tend to take consultation from some other sources. So currently, I think a lot of progress is to be done. There is a good start from government in terms of launching a platform like Abha, which I think will be creating some kind of digital health ID, and subsequently the data can be stored over there and can be accessed with the consent of the patient. So it's a very wide topic, and I welcome all the panelists and all those who have taken time to hear. And I think my sincere thanks to World Digital Health and Wellness Forum for having me here. Quite enlightening, and I think we have very diverse and good panels. So maybe I think introduction is already done by Mayank, so we can probably jump into the directly the questions. So my first question would be from Ms. Deepika. I think probably if you can answer on what are some of the opportunities and challenges in patient health data interoperability, and how it can be integrated in a better unified way, delivering seamless patient experience. I think we all know the importance of data. Now, I think data is something which is there in our watch, in our mobile, in our devices, in hospital, in diagnostic center. There is a lot of data related to patient finance. So over to Ms. Deepika, maybe if she can throw some light on this, and then other panelists can, I think, add on to that.
Yeah. Thank you so much, Nitin, for the introduction. I think with regards to data interoperability, I see there are more opportunities than challenges, and I'll explain, why.
Certainly.
I think in a country like India, there is a lot of variability in care. And when you try to merge different data sets, whether it's your EHR data set, your supply chain, your pharmacy data, you combine that with your insurance or claims data, we get a very powerful data set, and we are able to analyze where there is variability of care. I want to use specific examples so the audience and the viewers can relate to it. Back in the US, what we were able to do was we were challenged with a question, okay, how do we reduce the cost per case for a cath lab procedure, right? And this is for a hospital client. And to be able to do that, we were able to combine the data from the electronic health record. We were able to combine data from the cath lab, the procedural data, then from the pharmacy, from supply chain. And what we understood was there was quite a bit of variability in the cost per case when we added all those, data sets. And what we were able to show to the physicians is that without changing the risk factors, without impacting the outcomes, the reason some of the cases were high in cost was because of use of specific medication or contrast dye. Some contrast dyes are more expensive than the others, right? So the physicians were convinced we were able to standardize the case for cath lab procedures, and that's just one example of how we were able to use interoperability of data to impact the value-based equation for patients, which is high quality care, low quality cost. In terms of patient experience directly, right? I mean, I think there are plenty of opportunities: admission, discharge, transfer process. We are all familiar. And I think there is significant opportunity to improve that. One of the ways we are trying to improve that, at least at the Cleveland Clinic, is to see if there is any way to capture the intake form, right? Your history, your past medical history from home. That way, we reduce the waiting times of patients when they come into the hospital. Can think of several other examples. One inside hospital being pain management, right? Where patients can press a button and they can indicate their level of pain, and then there is a pain controlled machine that delivers a bolus in a very safe and effective way. So overall, I think we have a great opportunity here, to impact both the patient experience as well as operations efficiencies. And I think India has done a tremendous job. We don't have any dearth of infrastructure. I know some of my colleagues here have experience with the Ayushman Digital Bharat mission. I think we are in a very good place to utilize all the infrastructure. I was just looking at the adoption of SNOMED and the usage of electronic health records, and government has all the resources in place. I think the challenges will be with adoption, especially in the smaller, rural and tier 1, tier 2 towns, or where clinics are not able to afford those electronic health record systems. So adoption is one, and then clinical documentation. I think it's garbage in, garbage out. Otherwise, you have all these fantastic AI tools, some tremendous analytics available, but I don't know how we'll overcome the challenge of physician time in India, because if they don't document in a standardized, structured format, then we're not going to have that structured data to analyze. So I think that's one opportunity or one challenge. But at least in the US, we've been able to use a lot of mid-level providers, physician assistants, nurse practitioners to do a lot of that documentation, so the physicians can actually spend time, with the patients. So those are just my perspectives.
No, thanks, Deepika. Quite insightful, and I think you touched the grassroots, what's the challenges, what's the opportunity, and maybe I will request Mr. Anurag if he can add on to this subject, as he's I think very close to his expertise.
Thank you, Mr. Gupta. Thank you for the opportunity. So I think one good thing that we have done is we have implemented the basic things for ABDM, right? For example, we have interoperability of data now. We have interoperability of services also, and we are moving towards interoperability of insurance, right? So idea is that as a patient, if somebody goes from one hospital to another, they should not be required to carry physical files. And that objective has been achieved through ABDM, right? Now, I think what we need to do is we need to move towards adoption in an accelerated manner so that all hospitals get onboarded and all HMIS systems get integrated, so that wherever we go, we see a digital payments kind of experience. Because today I can go from one pawn shop to another, and I can use Paytm, I can use PhonePe, any other provider, and there is interoperability. Similarly, if my health records can be accessed through all channels and can be accessible to all doctors and registered users, that is the ultimate objective, right? So we have to move towards adoption. We have seen some challenges in the past. For example, the funding is limited right now. So if you go to a small clinic, they may not want to spend too much on HMIS systems. right? But they still want to get onboarded on the digital journey. So we have to make sure that these systems get affordable, and there is some funding available, some subsidy available from the government. I think there are a lot of initiatives that are going on. There are some free systems also available, but we have to see how does a small clinic or a PHC, CHC in a tier 2, tier 3 area gets access to that ecosystem, and they start participating in the digital ecosystem, right? So that is, I think, the most important thing right now, and there is a lot of focus from NHA as well, and we are happy to see the progress.
Yeah, thanks, Mr. Anurag. I think quite valid point. How do you see, government and private, these are two engines of growth of any economy, country. Here, how do you see their roles? Maybe, can you throw some light? What you think should be done by the private sector, and what you think the support government should provide?
See, government can only be an enabler, right? They can't be funding private setups. But I think a lot of these initiatives will be driven through market forces, right? So if a clinic feels that by being ABDM enabled, they can get more business, they can get more patients, or even if it's a single doctor setup, he can get access to virtual teleconsultation patients, they will definitely participate, right? So I think a lot of it will be market driven, and we see a lot of players offering affordable solutions, which are subscription based cloud solutions, which actually make it affordable. So I think everybody is in it together, and government being an enabler has played their role. But I think we just need more players to come in and adopt.
Yeah, sure. Thanks, Mr. Anurag. We have Dr. Ashish also, who is kind of service provider, entire healthcare, handling patient, handling inside, and handling, of course, the intermediate data management. So any insight from Dr. Ashish? I think you must be managing all three aspects.
So from the hospital perspective, I think I belong to an era which has seen all, paper-based patient care management in my early days. And from that time to today, where, you're totally unexposed to the EMR or EHR health record, or for that matter, any HIS usage in our system. For last 6 years, if I see my data, I don't remember, when was the last time when I wrote a prescription. So having said that, that kind of adoption, has become, a commonplace now. In our facility, 95% of the doctors are using EMR, especially for diagnostics and their order entries. Yes, what ma'am said, garbage in, garbage out. They are not able to, do the history examination and the critical, part on the EMR objectively, so that data is not worth analyzing. But I think slowly and steadily we're going there. The physician time management, yes, that's one important thing. But in last 4 years, every clinician has realized the importance of being on the system, because now they are able to change their treatment while on the go. They are able to see the critical results even when they are not in the hospital, and they are able to institute the necessary treatment. So that has given a lot of value to the clinician. If at the end of the day, any digital intervention is going to improve the patient outcome, the clinician will definitely be on board. Yes, when it comes to an organization, maybe expenditure or the capex expenditure on IT and digital efforts, maybe fifth or sixth, on their priority list. But slowly and steadily, it is growing up, because we are seeing some value in it. We are seeing some, lot of government initiatives getting on board. As simple as, you look at the NABH 5th edition and how the audit is happening now. Every small little thing is going online. If you look at the DNB curriculum program, if they have to conduct an exam sitting right from their head office, they are conducting the final exams through online platforms. So things are changing, and like what Mr. Anurag said, market forces is driving, but also the value which it creates, or sometimes it becomes a compulsion for the hospital to comply to the digital norms and many platforms. So overall, it's going in the right direction. I hope that with the kind of patient load we have in every hospital, whether it is government or a good private hospital, I think digital transformation is only going to improve the patient's experience. It's going to reduce the waiting lines. It's going to reduce the wasteful activities in the hospital. And of course, the clinicians, will gain best out of it. As an organization, one has to be very, focused on slowly and steady implementation of a particular intervention which is of most value for their set of patients. It could be different for single specialty, it could be different for a quaternary level hospital like Medanta. So one has to best requirement for their own setup in according to business, do a judicious
I would request the Alma team to kindly mute, please. I would request Alma team to kindly mute, please. Sorry, sir. You can go ahead.
Anurag, please mute.
Please go ahead.
This could be one of the side effects of
digital world.
That's about it.
No, thanks, Dr. Ashish. I think quite valuable input because you handle both sides, like probably the provider side and the patient side, because you are directly frontline, patient experience. So my next question is from Dr. Harsha. I think we talk about a lot of devices, digital healthcare devices, and how can we devise more ease of use in digital health devices, and so that patient experience is improved. Ultimately, we all are striving towards better patient care. So fintech has changed again, I would say. So any insight from health tech to adopt fintech kind of speed? Yeah. I think you're mute, Dr. Harsha, you are on mute.
Yeah. Thank you, Nitin. I think one of the points I wanted to talk about this space, particularly when it comes to the patient experience, especially when it comes to managing devices and data, comes from personal experience at Restory, because we handle a lot of geriatric patients, and we have seen this gamut that over the last maybe 10 years, what used to be earlier, people would just carry a passbook which they would go to their own primary physician or probably their neighborhood hospital, and that would carry their entire history and de facto become a very simple record for people to see ki kya hua 10 saal pehle, kya hua 20 saal pehle. But that has changed now. In the last maybe 3 decades, we are generating, and like Deepika has mentioned, it's garbage in, garbage out, because at an average, we have a healthy person generates 8 to 10 pages, and a not so healthy person generates maybe 30 to 40 pages of data per year. And all of this comes from multiple sources. So we have sources both in the urban and rural segment. Urban segment, like most of my colleagues on this forum, they're all tech enabled, they're all digital enabled. So you can always access the reports. You can always go back to the source and get the reports. But the challenge that happens now is there is definitely a loss. There is what we call as signal incoherence is there. People go to meet with the doctor, and suddenly you realize that there is data missing from a particular segment. And the bigger problem is not with carrying the data around, but the bigger problem is end of it impacts the clinical decision making process. Or from a cost perspective, we are a very cost sensitive nation, barring the top maybe 10 to 12% of people. Even going for regular lab tests on a continued and consistent basis as an out of pocket becomes a pain point. And this fragmentation has been a challenge. And I think 2 people, that is yourself and Dr. Ashish, have mentioned a very valid point, and that is something I think the entire healthcare industry should look at insights from, which comes from fintech. 10 years ago, the process of knowing your bank balance, the process of knowing if you've spent 10 rupees would have been go to the bank, stand there, get the passbook stamped and come out. And then ATMs came in, and then you would just walk to the nearby ATM. And now with this whole new 2-factor authentication, just being able to get an OTP and then download any app and get your data. You can be bank A, bank B, bank C. You can be a small rural bank. You can be the largest bank in India account holder, and still you get both your data on one point, as long as because everything pivots around 2 numbers. It pivots around your mobile number for authentication, and it pivots around your PAN number or other number for enrolling yourself, for registering yourself. And we have all this technology which is already there, and fintech over the last 7 years has democratized technology to a point where even a person who let me give a very simple example. Even a pani puri wala or the guy of the CEO of a Fortune 500 company uses the same tool at the same cost. And for a country like India, I think that becomes a very, very critical part, that how can you democratize technology to a point where the cost becomes non-prohibitive. That said, I'll get into the core topic, which is about devices and patient experience. So when we look at devices today, there are three grades of devices that we see. One is your clinical grade, your hospital monitors, you have your hospital connected systems, your imaging, etc. Then you have your consumer grade, which is probably skyrocketing at 200 to 300% year on year, which is your wearable watches, your Holter trackers, wireless Holter trackers, chest patches. People are watching sleep bands. And suddenly we realized we have gone from having 10 to 20 data points coming in every month, where you typically would go to a clinic to get your blood sugar or blood pressure tested, to now devices collecting. An Apple Watch collects maybe 3,000 to 4,000 bits of data every day. And all of this is just lying around, being extremely individually accessible, but not really going to the doctor when the doctor needs to see it. And that leads to poor quality consultation, poor decision-making process, and ultimately that leads to poor patient experience. So we've had a recent example where somebody I know, a doctor, a big issue happened at the clinic just because they say that, oh, the doctor didn't ask me whether I had an MRI done earlier and prescribed an MRI. Now the problem is there is no record of that MRI for the doctor. And we don't have the time or bandwidth to ask everybody, oh, have you gone to somebody else? Have they given a prescription? Unless the patient is forthcoming about this data. And the challenges that we see when it comes to this particular aspect is that one is the cost. So in a country like the US, healthcare technology, particularly in the space of giving accessibility to information, you have these large organizations, you have Cerner and Epic, and the cost per patient is absolutely unviable in a country like India. And as Lataji had spoken earlier, I think the whole ABA concept is something the private medical field, the health tech providers should wholeheartedly embrace. But that leads to a second issue, which is to be onboarded, with a platform like Epic or Cerner, all your data flows in a certain way. It is all coded under ICD-9. It is all coded under ICD-10. So I know that ABC lab giving a blood report for my hemoglobin and an XYZ lab giving me a blood report for my hemoglobin will all flow in the same data structure, which we currently don't have. Even two labs today, let's say I prescribe a CBP to a patient. They come back and say, this lab doesn't have CBP. They have something called a hemogram. And now medically, we know that, I think Dr. Arjun would know this quite well, coming from the diagnostic space. Both of them are the same, but just because of the lingo change, the data doesn't flow very safely. And the long-term solution obviously has to be, unified coding. We need to get to a level where all data is accumulated at one place and we bring the cost down of data. But from where we are to get there, we are talking about maybe about a $25 to $30 billion expenditure, which the private industry will never be able to keep up, because I can go charge, I would have patients who would pay 1,000 rupees for a consultation, but if you add on a 100 rupee cloud charge to that consultation, they would just walk out saying, because the mindset has still not come there, that education and awareness is missing. But I think in the shorter term, I think we should use platforms like ABBA. We should take lessons from, the experienced people in the fintech industry on how can we use WhatsApp, because now WhatsApp has become a very personalized democratic tool to receive data. How do you trigger an OTP? How do you trigger information sharing to using your mobile number as a base? Will this apply to 100% of people? Maybe not. But I think as it stands now, people who use private healthcare and maybe about 80% of people who use public healthcare do have access to all this data. They are registered through various banks. They are registered through unique identifying markers. And over a period of time, like how they have done in China, we should start pivoting around one universal ID. Let the data come in any way possible. But once the data starts coming in and people realize the value of having all this data at one place, patients start feeling better because they see that their experience when they go to various providers gets better. And as the next step, we can start looking at charging patients, because again, nothing comes for free. Charging patients to be able to hold their data, consolidate their data, rather than what the new health tech companies are doing today, which is create a solution which is unique, which is customized, be able to go to market and tell people that, oh, my EMR is the most advanced, it has AI built in, it has logic built in, and then struggle to find 10,000 people or 5,000 doctors who will use the EMR. And I have seen adoption rates plummet down the line, because end of it, what doctors want is, I want to see the data. I'm not going to sit and train my receptionist to start typing in. And organizations like Akash and some of the larger corporates have really taken this up on a war footing basis by digitizing their entire patient journey. But then end of it, they cater to maybe 2% or 3% of the population. The remaining 97% of the population is suffering from poorer clinical outcomes, poorer patient experience, because they are unable to get their data given in the right way. And I think unless we are able to bring in the clinical and consumer grade enterprise devices all into one platform, let the patient authenticate it every time they go to the doctor, so that this willy-nilly sharing that happens today is not there. I think that is a question for the next topic, which is about data security. This will also solve the data security challenges that we have. Thank you.
No, thanks, Dr. Harsha. And I think quite valuable. And as we say, when we opt a delivery in Amazon, we always hate 40 rupees charges. So that's how the mindset is built. And as you said, if you bill something for digital, they take it, it should be there. But I think slowly progress is happening. So my next question would be with Dr. Arjun. I think we talk a lot about technology, data transfer, technical issues, but I think we are human, and humans are probably more of habits. How do you see behavior from clinician side to have a better integration of data? What behavioral changes you, Dr. Arjun, expect from more of clinical side to better accommodate the data, apart from the technical challenges which Dr. Harsha shared? I think more of behavior, first behavior is corrected, and technology is always there to support that behavioral changes. So over to Dr. Arjun.
Thank you, Nitinji, for that very relevant question. Before I start, I would like to thank WDWF for having me on this esteemed panel with such stalwarts in the healthcare domain. It's really fun because I've been listening in for the past 15-20 minutes, and very interesting, because the way that I see it is that digitization has a different definition when you look at the different stakeholders in the ecosystem. Whereas a lab is a completely different point of view, and completely echoing Dr. Harsha's words, that I think half our customer care is always baffled by CBP or CBC or PS or a hemogram, and there are 5 other terminologies that we can come up with. But I think that uniformity that is there, not only starting from the prescription, but to the ultimate report, is, I think, the beacon of hope that we see in the years to come. Now, the ABBA ID is something that is fantastic. Very proud to also tell you that we are one of the first labs that's completed the M1 milestone. But I think in this entire process, what goes unnoticed is that from a perspective of a histopathologist. So I'm a histopathologist, and for the ones who are not aware, basically we look at biopsies and then try and figure out what the diagnosis is. And we encounter this on a daily basis. The quality of my report, and I can scream this from the top of every mountaintop, is that the quality of my report is directly proportional to the patient history, the clinical details, the medication that the person is on, the family history. And without that, the quality of my report can go from a 2 to 10 till a 10 on 10. So that is how important it is. And like your question, Nitinji, you asked that how can the behavior change? I think basically in big, bold capital letters, it is collaboration versus competition. And the short-term goal is obviously competition, but the long-term goal is collaboration and to give the patient the better outcome. Now, also from a cost perspective, I might have to run 3 more tests to give the same diagnosis, whereas that same patient would have done some similar test or some immunohistochemistry markers or some other genomic test earlier that can empower me to mention that in my report and then give a conclusive diagnosis. So I think patient care and patient outcome is something that is certainly on top of the charts, but also looking at it from a research perspective. And also my team does a lot of that. Just a small example of how we do these surveillance studies, and it actually guides the government and state governments and the central government to actually focus on that particular disease. For example, now you have a vaccine regimen for children, but until we actually find out that what is the antibodies that are present in that particular community, and then convey the incidence versus the protection that that part of the population have. I mean, the government will just be guessing about which vaccine to introduce, which disease area to focus on, where the budget should be putting their finances in. So I think it's a very, very large domain where we are working in, and definitely the behavior part where awareness, education. I think after collaboration competition, the second would be awareness and education about understanding about standardization, understanding about interoperability, and also very important from the lab's perspective is to empower and incentivize. I'm sorry to say, but incentivization is extremely important for the LIS vendor, that is the lab information software vendor, for them to get a push. And even the ABDM this time, my compliments to them, the way that they're doing it on a war footing, where there is an incentive, very small incentivization, but significant one for the LIS vendor and for the labs as well. I think that is phenomenal, because that is obviously pushing them and their teams to achieve this faster. Also, in a country where we have last mile delivery as a formidable challenge, I feel the uniformity and the interoperability between the different LIS vendors, I think, is critical, because lab as such is a service provider where I would say 9 out of 10 or maybe 99 out of 100 labs do enroll a particular LIS vendor, similarly for hospitals, unless you have your own inbuilt one. And if these vendors collaborate and are incentivized by ABDM, which they already are, I think the information and the data, the way it will start flowing is going to be very interesting. Also from a lab perspective and on ground, I was just discussing with my team the earlier day. We've recently integrated our customer care software and our LIS software and our CRM. Now, what this actually does is that we did like a small study in which we were able to reduce the number of double pricks that we do in a month to actually 30 to 40% lesser. Now, someone will ask, how is that possible by integrating your different systems? And it's really simple, because we basically integrate the feedback from the patient and the phlebotomist to our CRM before assigning another technician for the same patient. So in this world, I feel from small to big, this interoperability and integration of different systems supported by the government initiatives and the behavioral change in physicians, clinicians, and the healthcare stakeholders is, I think, going to be critical and very interesting to see in the years to come.
Sure, Dr. Arjun, I think very insightful. And I really like, I think, as you said, the competition versus collaboration. I think both has to be there and both have their roles to play. Like when we cook dishes, there are different ingredients. So these two are good ingredients. So in relation to that, Dr. Arjun, maybe taking the discussion forward. So when we talk about patient empowerment, they have the data required, but then a risk comes self-interpretation. How do we make patient aware that, okay, you are in charge of your data, but we are the clinician, and our diagnosis and our treatment will be the thing, better interpretation of data. So how do you see the risk when transparency increases? This risk also increases. So any thoughts on?
So Nitin, on a lighter note, yesterday I received a call from an elderly lady, and the customer care manager told me that she's screaming, sir, and someone from the doctor's team needs to speak. It's better if you speak. So I'm always excited to speak to patients and assist them. So I was like, okay, transfer them to me. Elderly lady speaking in Punjabi, can't repeat her words, but she said that to see urine culture sterile ditta hai. I was like, yes, man, it's a sterile culture. You have no growth in your urine, and that means you don't have any infection unless you were on antibiotics. And she said, how can you say I'm sterile? I have 2 grandchildren. So she has Googled what sterile means, and she's gotten to the point
Okay.
what sterile means, and then she's interpreting that. So obviously, ChatGPT, Google, I think this is actually either can be an assistant or it can be the big bad wolf. And obviously, interpreting your results correctly with the physician's help is critical. Now, what has actually happened in the past few years, and even we were one of the first few adopters, is that you have these smart reports that actually help patients interpret the report in a very simplified version. Instead of using scientific jargon and instead of using very high-fly wording that they can't understand. It's actually broken down to understand what this means, what they can do on a daily basis from a perspective of lifestyle and follow up, and then take it forward. So I feel educating patients is very important. Also empowering lab providers with such tools that helps us break down the reports in very easy to understand paragraphs or wordings is critical. And also along with this, apart from this, the patients to understand that the final gold standard for any diagnosis is not a good lab, it is not your investigation, it is the doctor who's actually examining you and then looking at the report. I think that needs to be hammered in and that needs to be understood before people start looking at reports and understanding and interpreting it themselves. And so just a very small example of another very common female hormone test that we do, and maximum queries come for that. It's called a prolactin test. Now, what happens in a prolactin test is that it's maximum as soon as you wake up. So a lot of teenager girls get this done for their PCOS, other hormonal profiles, and the instruction for that is that you have to wait for 3 to 4 hours until you wake up and then do the test. Otherwise, you might get a falsely elevated prolactin level. Unfortunately, with an elevated prolactin level, if you type these 3 words on Google, you get a brain tumor as the headline. So we get and it is true, an elevated prolactin level is seen in a pituitary adenoma, but that is not the case in 99 out of 100 patients. It's just that they've had a late night and woken up late and given the sample soon after waking up because they thought it was fasting when it's actually not. So again, I think that education, that instruction, that training of medical staff so that instructions flow freely to the consumer or the patient side also is critical.
I think on the lighter side, Dr. Arjun, I was reading my physicians, like, no, he has very clearly written, keep your Google knowledge out of the room. So very, very relevant. I think we talk about a lot about devices, data, and like, no, integrity, but I think patient has to be equally updated, educated on like, no, how do we really see the data, and clinicians are the best judge. I think, yes, we can make some interpretation out of it, but yes, that's very good. Thanks, Dr. Arjun. And I think now, I think we are moving to probably another section of future. We always see future. So how do, like, no, maybe my question is more towards Mr. Anurag, that like, no, how do you see the future of these devices, like, no, interconnected, interoperability, and like, no, data is now in our watch, in our phone, like, no, in our lot of wearables. You can do 24-hour glucose monitoring and other stuff. So a lot of data available, but how do you see, like, no, it can be seamlessly for patient experience future of these devices? Maybe any like no trends, maybe AI is something which is, I think, changing the game everywhere. Telemedicine we saw in COVID, I think, no, it has helped a lot. So maybe Dr. Anurag and Miss Deepika, I would request if they can throw some light through their experience.
Yeah, thank you, Mr. Gupta, for giving me an honorary doctorate. I'm not a doctor yet, but thank you so much. I aspire to be a doctor one day. I think what I want to do is I want to focus on the mass market here, right? So while people on this call, all of us are in metro cities, and we are all well educated, and we can access all these digital systems. But as a future, I think what we want to do is we want to cater to the mass market, the Bharat citizens, and make sure that they are digitally included, right? So one suggestion is that while people are talking about Chat GPT, AI, we have to make it very accessible for all the rural citizens also, right? So imagine a rural farmer sitting in Tamil Nadu who doesn't read English. He wants to know where is the nearby Jan Aushadhi clinic, or he wants to do a test, right? So he has no way right now, right? Either he will dial a helpline, which people may not answer also at times, or he will try to navigate on the website, which is not readable, right? Because he can't read English. So we have to focus on digital inclusion through technology, and we as Reverie, we are focusing on that. So we need to make all these digital interfaces multilingual for all official 22 languages, at least to start with. We also need to make it very simple for people to access, right? So right now we are focusing on interfaces which require reading, but imagine a conversational AI interface that provides answering capability in regional languages also. So elderly Punjabi lady, rather than cursing on the helpline, if she can talk to her voice bot and she can get answers, and she can also read about some of these tests or whatever, right? That is the future of technology that we want to see. And we have to look at other futuristic applications as well. we have to make it, maybe a portable healthcare assistant which can be made available, where at least I can read up about, if I have some problem, at least for basic diagnosis, I can talk to that personal health assistant, and I can book an appointment. I can do my daily tasks, right? That is something that is required. And obviously there are advanced applications as well, which can be looked at. But my focus is to look at how do we focus on digital inclusion and make it very simple for patients.
Yeah, I think ease of use is something, Mr.
Absolutely.
God, I think, yes, that's very, very, very relevant, because we have all skill set of patients, like no tier 1 patient, metro patient, very advanced, very like no at all not. So I think Dr. Ashish is here. Maybe any aspirational, like no this kind of technological changes which you are look at in terms of better patient. And for example, patient coming to hospital, you can ask them to do basics, maybe BP, sugar and other stuff at home, and you get that data. So something aspirational in terms of, and some trends of the future in, yes.
So if you talk about things like remote monitoring, yes, seamless monitoring of blood sugar at home has become a commonplace thing.
Yes.
And apart from that, so many startups have come up who monitor the basic parameters, who just like Holters and other things, where they get seamlessly transferred to the clinician in charge. Even in hospital, while the patients are placed at various floors, ICUs and wards, the clinician has a dashboard on their phones to monitor any red flag if it happens all of a sudden, with causing a code yellow or code blue scenario. So that also gives them a snapshot of how the patients are performing even while they are not on the rounds. In my own specialty, like orthopedics, very recently we have come across remote monitoring for my knee patients who, after going back home, it's very difficult to track their movement, how well they are doing physiotherapy, what is the joint balance, how many step counts are they doing, and how they are complying with the physiotherapy. So we have very recently acquired a product which it's a remote monitoring device which gives you a live monitoring of whosoever patient is using that monitor for. It is basically for joint patients, or for that matter later on it can be used for any knee or a hip or a spine problem patient, where those sensors can give the live feedback to the phone of the patient, and then that gets transferred to the clinician or the auditor who is taking care of all the patients at the same time. So a lot of data gets collected, and we get to know patients who are not doing well initial few weeks, maybe their step count is less. So if any outlier we find in that a collection of say 50 odd patients who are on the monitoring device, we can institute early interventions to see whether there is something wrong from the surgical side or from the patient factors. Is there anything we can do to get him back on the track on physiotherapy and all those parameters which we have set some benchmarks. So these are some things which are coming up in a big way. Yes, of course, things have to make sure that whatever new technology we institute, ultimately it should benefit the patient first, followed by the clinicians, and of course later on the organization should also benefit out of it, because otherwise the motivation for organization to invest in a technology becomes low, and for a physician to continue to use it, because it's very difficult to change the mindset of a clinician. If they don't find value, they will outrightly reject it. So that's something which is a combination. So whenever we talk to a startup, we always see whether there was some I would say mentor from the medical side. If the IT people are making a product for the healthcare industry and they don't have input from a healthcare professional, I think they are heading for something which may not become a sellable product, or a unicorn for that matter. So one such product we are seeing, it is also in the early phase. They have already done 500 patients outside India. I hope that that's going to be something which gives us more confidence in relying on wearable devices for trusting them for our patients' outcomes, and also to monitor them from a remote. Especially in India, such things can be a major boon, because a lot of patients come from villages and they may not have an access to telephone as well. So that gives a first-hand experience, or we can track from a distance, because once the OPD becomes so high and your over a period of 6 months, you have got 500 patients to monitor. The technology has to be in place so that we are able to give the right intervention at the right time and monitor the patients even from our clinics or the hospitals.
So thanks, Dr. Ashish. I think quite a relevant.
Yeah, Mr. Nitin, I would request you to kindly wrap up in next 5 minutes, please.
Yeah, sure. Yeah, I'm on
Thank
it.
you.
Maybe Miss Deepika would have a lot of insight towards telemedicine. I think that's part of her expertise. So maybe quickly, if we can, share about the trends around that. Yes.
Thank you for the opportunity. I think telemedicine has played a huge role during COVID, but I think there is a potential much beyond, just urgent care, express care clinics through telemedicine. I think what we are doing at Cleveland Clinic is virtual peer-to-peer consultations, where on very complex cases, where there is not enough research. There's a lot of collaboration between different hospitals in India and our hospital in the US, where we are able to collaborate on those cases. Now we are experimenting with digital stethoscopes, where the heart and lung sounds of patients can also be sent, to different hospitals. So I think there is huge potential. There's benefit to the patients. We've been able to cut down, some of the misdiagnoses, that can happen, anywhere in the world. And so on. So I know in the interest of time, I won't give you specific examples or data, but I think it has a huge potential.
Yeah, we all seen telemedicine contributing a big way in our past pandemic. We just got over it, and this helped really the patient and the clinicians both. So I think with this, I think we have a very good discussion, and I think there are a lot of stakeholders, patient, service providers, doctors, clinical side. I think as if we can put all in one frame and think about that in future, and the way IT is growing in future, even if you go to tier 2, tier 3 towns, 5G network present, 4G network connectivity, I think the future is bright. Digital health is brighter, and I think as I will conclude saying this will help us in 2047, healthier, individuals will help, healthier citizen will help in India becoming a developed country, which is our ambition in 2047. And I am sure digital health will play a great role. Thank you once again to all the panelists, and I would like to sincerely thank taking your time and sharing the expertise. And yes, sure. Thank you so much. Thanks.
Thank you. Thank you so much. I would request Dr. Harsh also to kindly open his camera so that we could have a select as well. And apart from that, thank you so much, Mr. Nitin, for making it so crisp. There are many questions which have turned up, but I'm just going to take one of them, and I would just push it to you and see what best you can offer. Somebody have asked an interesting question, that what benefits can government be giving in terms of seamless patient experiences when it comes to digital healthcare? I think they are trying to say what benefits you recommend the government should offer for a digital healthcare system, where, for example, I personally feel that Practo is one of the big examples where it really helped people throughout India during the COVID times. But if you could have something more similar, something more practical from the government perspective too, will make a lot of difference. I give it to you, sir.
Maybe I think Mr. Anurag is the right, he is into it, and he can throw some light on it. I would request Mr. Anurag to.
See, I think government is already doing that, right? I think what they have done is they have created credible sources of information. All they need to do is make it accessible for everyone, right? So that itself is a big incentive, that I don't have to Google and look at advertisements, right? I can have credible sources of information, that who is my nearby cardio doctor, which is my nearby lab offering this service, right? So if that credible source of information itself can be provided, that itself is a very, very big incentive.
Absolutely. Absolutely.
It's a plus.
Yeah,
government
great.
always is kind of enabler. I think delivery is to be done by private segment, and government will facilitate the environment. I think that's the
absolutely.
Thank you.
Absolutely. Thank you so much, sir. Thank you, Mr. Nitin Gupta, and thank you so much all the panelists. It was lovely having you with us. We hope to connect very soon again with the offline version of the event, which is scheduled in the coming months, and we'll be updating you about the dates for the same as well. Thank you so much.
Thank you. Thanks a lot. Thank you.